My name is Steve Bogosian. My expertise is actually orthopedic surgery with joint replacement as being my subspecialty. My undergraduate work actually was done at West Point. I was an infantry officer for 4.5 years, and I went to medical school here at the University Hospital at Upstate Medical Center. And I was in California for a year of internship in Santa Barbara in general surgery, and then I came back to Syracuse to do a residency in orthopedic surgery. And then I went to Boston to do a year's fellowship in joint replacement as an all-Frank fellow at New England Baptist Hospital. I didn't end up at St. Joseph's initially. I worked at a different hospital up on the hill at Community General Hospital for a number of years. And I've been at St. Joe's now for about a year and a half. And the reason for that is St. Joseph Hospital has always had a good reputation. It's a place where a few of my partners work, and some of us decided that it was time actually to consolidate a lot of our care of our patients in one facility. And the majority of that was for joint replacements and spine surgery, but mostly from my standpoint, joint replacements. And we thought it was best that a lot of the high volume surgeons get together, have one facility to all work out of actually for the care of our patients. And we need very supportive care from a hospital standpoint, not just from the facility, but also from other physicians, internists, general surgeons, vascular surgeons. There's a whole array of subspecialty help that we need as orthopedic surgeons, and there's no question that St. Joe's has a wide variety of subspecialists that are very good at their field and are very supportive for us. We as physicians, if we care for something on a regular basis, we have our own team of not only the OR personnel, but how we do our job. Essentially, we're technicians in an operating room, and how well we do that job will dictate how well they will do in the postoperative course and how satisfied they are with their end result. So how you get that experience is dealing with volume. If you only do an operative procedure in a year 4 or 5 times, you may do an okay job with that. But if you have a surgeon that does 200 or 300 or 400 procedures in that same time, you're going to find a surgeon who actually is very competent about how he cares for the patient, how he deals with different situations, and also how well you'll do as a patient at the end, because that surgeon is used to seeing many different problems that he will address at the time he needs to. Medicine is an evolving science. What I do today is completely different than I was doing 20 years ago. And that's true for a lot of us. I mean, so it's an evolving science. There's certain things that we thought were the best 20 or 25 years ago, and now realize it's probably, there's a way to make it a bit better. But overall, the goal is to make a patient feel comfortable, have them understand why we were there and what's happening with them, so there's not any confusion of what our end result is, and that's essentially for them to have the best care that we can provide them.